sink in here, but I'm using Purell for the sake of having no sink. And I would sing happy birthday 2 times washing. And I introduce myself to the patient. I would provide privacy. And now I'm going to confirm her name and date of birth.
Gabriella, and February 23rd, 1995.
Okay. And what's the year?
1995. Oh, this year, 2018.
And do you know what month it is?
August.
Okay, do you know where you are?
Lincoln Tech.
Okay, and who's the president?
Donald Trump.
Okay. And are you having any pain today, Gabby, before we start?
In my stomach.
Oh, in your stomach? Okay. Alright. And I would have already previously have taken her vital signs, her blood pressure, O2, which is the pulse ox, her pulse, and blood pressure and temp. I would have already taken and gathered on the patient. So now I'm going to start with her. And for that stomach pain, how long have you had it for?
Like a week or two.
A week or two? Okay, and are you taking any medicine for it?
No, I just was taking like, I don't know.
Okay, and about where does it hurt on your stomach?
Like down here.
Lower?
Mm-hmm.
Okay. And does it hurt any more when you're eating, going to the restroom?
Going to the restroom.
Okay, alright. Alright, we'll get to that later on when I go down further. Okay, and because of that stomach pain, you don't have any dizziness or anything, right? That we should be concerned about? Okay. And as she's talking to me, I'm assessing her speech. She doesn't seem like she has any speech problems. And now I'm just gonna have her raise her eyebrows, stick out your tongue, move it side to side, and puff out your cheeks, smile, and frown. Good. And so no dizziness, no tingling, numbness
Nope.
anywhere? No. Okay, awesome. And now we're gonna just check your range of motion. So if you can just push down, okay, and up. Good. And grasp my fingers. Good. She's equally grabbing, so that's good. No weakness on one side. And could you move your arms for me? Rotate your shoulders, your wrists. Okay, good. And as I'm looking, could you just take off your jacket for me? Okay, so I'm going to be assessing her skin, making sure she has no bruises or scars anywhere, nothing like that. Everything seems good, normal, no cuts. You don't have any specific scars or anything
No.
anywhere, no? Okay, but if the patient would, I would have documented, you know, if she had a bruise on the anterior forearm, I would document that, but she does not. And I'm going to now assess her skin turgor, so I pinch on the clavicle, and she has very good skin turgor. She's not dehydrated. So yeah. Now we're gonna inspect the head. I'm gonna palpate, make sure we're looking for any bumps. It's equally distributed, the hair, and no lesions, no bumps. It's cephalic, which is round. And I'm gonna ask the patient if she has any vision problems. Nope, nope, everything's good. Okay, and no glasses, no contacts.
Nope.
Okay, so I'm gonna assess the patient's eyes now. I'm just gonna check. Her sclera is white. Her conjunctiva is nice and pink. I don't see any redness, no inflammatory things going on with it. And her iris and her pupils look equal, nothing going on there. So now I'm gonna check, I'm gonna do Perla. So like I said, the patient's pupils are equal, pupils are round. Now I'm gonna see how the patient reacts to light. Okay, I dimmed the lights for this just to make sure I can get an accurate viewing of the patient's pupils. Her pupils did constrict, and I would say they are a size 5, which is normal, 5 millimeters. And now I'm going to check accommodation, looking for any nystagmus or extraocular eye movements. So we're going to do, can you follow my pen light? Okay, good. Patient doesn't show any nystagmus or EOM, which is extraocular eye movements. And now I'm going to check the accommodation. Good. All right, so now I'm going to assess the patient's ears, and why I'm assessing the patient's ears to make sure there's no drainage, no pain, make sure the lymph nodes next to the ears are not inflamed, because that would lead us to suspect an ear infection or any type of infection with the lymph nodes. So good. Any pain? No. Okay. I'm just gonna look inside your ear and make sure. Okay. So I'm gonna pull the ear up and back, and just look inside the ear. If I was able to see her tympanic membrane, it should be a pearly gray color, and that would indicate that there's no infection in a healthy tympanic membrane. Now I'm going to assess her other ear, make sure the same thing, and that ear is also looking good on the patient, pearly gray, no infection, and no redness. And now I'm going to look in the patient's nose to make sure that the patency, there's no drainage, and I'm gonna look and see if she has a deviated septum. So could you look up for me? Good, everything's good in there. So what I'm gonna have you do is I'm gonna have you hold one nostril and breathe in, good, and hold the other one, breathe in. Okay, so the patient doesn't seem to have a deviated septum, which is good, and now I'm gonna move on to the patient's mouth. Any hoarseness or sore throat? No pain while swallowing, nothing like that. Okay, so now I'm gonna have the patient open her mouth for me. Wider. Okay. No thrush, the teeth are in good condition. She is not missing any teeth. Okay, stick your tongue out for me and up. Okay, looking at those bottom teeth. Looks good. The buccal membranes in the mouth are pink and moist, looks good. The lips are also pink and moist. No cracks, no lesions, nothing like that. And are those your real teeth or dentures?
Real teeth.
Okay, so if it was an older patient and she had dentures, then I would also document that the patient has dentures. Now I'm gonna move on to the patient's neck, and I'm going to auscultate her carotid arteries, make sure there's no bruits. Also with the bell of my stethoscope, and I'm never gonna do 2 at once, just 1 at a time. Okay, good. And I would also, before I would have done that, I would be inspecting to make sure there's no goiter, make sure there's no inflammation or anything going on. And now I'm going to palpate to make sure that the lymph nodes are not inflamed. No pain while I'm doing that, right? No, okay. So I'm gonna make sure that there's no JVD, and if she did have jugular vein distension, you would see it popping out on the side. Her trachea is midline, and I'm just gonna have her swallow for me. Just so I can feel, okay, good, no enlargement, and no pain during that, right? No, okay. Now I'm gonna check the patient's respiratory. So I'm gonna palpate the interior thorax. Just gonna check, okay? Good. There's no air bubbles or anything like that. The patient was not in pain during the process. So I'm gonna listen to the patient's lung sounds now. Okay. Deep breath. Breath. breath again. Good. And while I'm listening to these lung sounds, I'm also making sure that I'm not on any bone. And as far as the anterior lung sounds, they're clear, no wheezing, no crackles, and the patient is not complaining of any dyspnea. Do you smoke at all?
No.
No shortness of breath or coughing? Nope. Okay, I'm just gonna check your posterior lung sounds. Deep breath. Again, avoiding the bony areas on the back. And now I'm gonna check the patient's heart sounds, and we're gonna start off with the aortic valve, and then it is the pulmonic, the Erb's point, tricuspid, and mitral, which is also called the apical, the apex, and the PMI. And where they are located is the aortic is located at the second intercostal space on the right, and pulmonic is located at the left second intercostal of the sternum. And then we have Erb's point, which is located to the left of the sternum, third intercostal space. And then we have the tricuspid valve, which is located slightly below that. It's at the left lower sternum, fourth intercostal space. And then we have the mitral, PMI, and apical, which is located at the left fifth intercostal space. And now that I have named all those, I am going to listen to her her heart sounds, sorry. And how we're gonna do that is I'm gonna listen to it with the diaphragm side of my stethoscope, and then I will be switching and going back around with the bell of my stethoscope. So here we are listening to the aortic. And now I'm going to listen to the pulmonic. And now Erb's point. Tricuspid. And last, mitral. All right, and I'm just gonna flip to the bell and go back around. Good. So as I was listening to the heart sounds, I was making sure the patient wasn't in any pain, making sure that she wasn't shortness of breath. I do not hear any murmurs. I don't hear any abnormal heart sounds as well. And just gonna ask the patient, any chest pain recently? No, nothing at all. Okay, so there was no irregular rhythms. Are you fatigued at all?
No.
No, okay. And now I'm just gonna check her pulses. So temporal and then carotid, we check one at a time. Good. And then I'm gonna come down to the brachial arteries. Good. And then we'll come down to the radials. Good. And then I would check the patient's femoral arteries, but for the sake of this video, we're not gonna get there. Okay, and then I'm gonna check the patient's popliteal pulses. Good. Good. And then the dorsalis pedis would be about here on both. Okay, and then I check the ones on the side, which is the dorsalis pedis and the pedal pulses. Well, this is the tibial. Tibial, and this is the pedal, dorsalis pedis. All right, and then I would ask the patient to take her shoes off if she wants to. And before I go down to the feet, I'm going to check the patient's capillary refill on her fingers, make sure it's less than 3 seconds. Good, good, good. And then I'm going to come down to the feet. I'm gonna ask the patient to do range of motion. Good, good, up, down, good. And now I'm gonna ask you to just lay down on your back for me. I'm just gonna check that pain in your stomach, and then we'll move on to your feet so I don't have to come back up. Okay. So are you in any pain laying down in this position right now? No. Okay. So I'm going to start at the right side of the patient, which is gonna be right here. I'm going to inspect, but I'm not going to have her take off her shirt right now. So I inspected, it's the abdomen is flat, it does not seem distended, the patient's not in any pain like I had asked her. And now that I inspected the abdomen, I'm now going to osculate from starting with the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. So the patient has normal bowel sounds. They're not hyperactive. Let's say they're normal. But if the patient did have hypoactive bowel sounds or no bowel sounds at all, I would listen for a full 5 minutes before saying the patient had no bowel sounds. So now I'm gonna palpate your stomach. Okay. Starting again with the right lower quadrant. Any pain while I was doing that?
Yeah.
Where?
Like lower.
Okay, lower. And how is your elimination? When was the last time you used the bathroom? For your
Probably
stool?
like 3 days ago.
3 days ago? Okay. Are you taking any laxatives over the counter or anything?
No.
Okay, so this could be why the patient is experiencing lower abdominal pain, is because she hasn't used the restroom in 3 days. How about your urination?
It's okay.
Okay, by okay, when was the last time you went?
Today, this morning.
This morning?
Mm-hmm.
Okay, and would you say that's normal that last time you went was this morning? Have you been drinking enough water?
A little water.
Okay. Any burning pain?
No.
No, okay. So her urinary seems normal, and so we'll talk to the doctor about your lower abdominal pain. The patient could be experiencing some constipation that would explain her pain. So now we can have you get up because we're all done with your abdomen. And I already had checked all the patient's pulses. I would rate them a 2+, expected, normal. So now I'm gonna inspect the patient's feet and legs. So we'll check the legs for edema first. No edema, no pitting or anything like that. I'm gonna have you push up. Good. Push up. Good. Moving on to the feet. Check your capillary refill. All the toes. Good. And can you push down? Push up. Good. And push your foot against mine. Good. Good. She's equally distributing that weight onto my hands. And now I'm gonna ask if the patient can put her shoes and socks back on. And while she's doing that, I'm gonna go wash my hands and sing happy birthday 2 times. Okay, now that I've washed my hands and sing happy birthday 2 times, I'm gonna assist the patient onto the ground, and we're gonna assess her gait and balance. And the patient is not at risk for falling, so she's okay to walk by herself. So I'm gonna ask her to walk in a straight line for me. Good, and the patient doesn't seem like she's at risk for any falling again, so we're gonna have her come back. Good, and her balance is great. So that is the end of my head to toe, and my patient's nice and healthy.